After studying this module particularly, you will be able to know about the introduction and importance of forensic odontology, that's the another name for forensic dentistry, how this very important branch of forensic medicine, that is forensic odontology, has developed over the years, the role of a forensic odontologist, and the basic identification process of a teeth, how it helps. Forensic odontology is a branch of dentistry which, in the interest of justice, deals with the proper handling and examination of dental evidence with proper evaluation and presentation of dental findings. Forensic odontology is a vital and integral part of forensic medicine that is most widely used for the identification of living as well as deceased, that means the person who have died. In recent times, forensic odontology has evolved as a new ray of hope in assisting the forensic medicine. The probable reason for this expanded interest is that a vast number of forensic and legal professional, law enforcement personnel and insurance companies rely on the dental evidence for their operations. Forensic odontology has played a key role in identification of persons in mass disasters like aviations, earthquake, tsunamis, in crime investigations, in ethnic studies, and in the identification of decomposed and disfigured bodies like that of drowned persons, the fire victims, as well as the persons who are dying in a, you can say, attack of the terrorist attack during bomb blast, and the victims of motor vehicle accidents. The various methods employed in forensic odontology include rugoscopy, cheloscopy, bite marks, tooth prints, radiographs, photographic study, and molecular methods. Coming on to the history and development of this branch of forensic sciences, forensic medicine. Although great attention was not paid to the dental identification until recent times, the process has been used for more than 2000 years, as was reported by Barsley in 1993. The first case which was reported in this aspect was in 45 AD. The Roman Emperor Nero, he used dental impressions to identify slaves. This practice continued throughout Europe and the United States during the slave trade. In the 66 AD, the earliest recorded incident of use of teeth for identification is that of Agrippina, the wife of Roman Emperor Claudius, who demanded the disembodied head of her husband's mistress Lollia Paulina. The severe malocclusion and a discolored tooth confirmed her identity. Then there was a gap of around 1000 years. Then in year 1453, the first formally reported case of dental identification was that of an 80-year-old warrior named John Talbot. He was the Earl of Shrewsbury who fell in the Battle of Castillon. In 1776, Dr. Paul Revere, he is the first forensic odontologist in the United States. He identified the body of his friend and patient Dr. Joseph Warren, who was killed during the US Revolutionary War with the help of the bridge work, that is the prosthesis. In year 1837, the examination of teeth, official method of age determination for employment in the textile industry in England, was introduced as reported by Baker in 1982. In 1849, the dental evidence was first accepted in the United States court in the Webster-Parkman case. Dr. J.W. Webster allegedly stabbed and dismembered Dr. George Parkman on 23rd November in Boston. It was because Dr. Nathan Kipp's dental identification of Dr. Parkman's dental remains which led to the conviction of Dr. Webster. In 1867, Oscar Omido, an Italian dentist who helped identify hundreds of victims of the Great Fire of Paris. He used techniques and protocols developed during that fire, and they are still in use presently also. In 1897, the first dental mass identification in Paris after a fire broke out at Charity Bazaar, resulting in 126 deaths. In 1898, Dr. Oscar Omido wrote the first textbook on forensic dentistry titled L'art dentin en médecine légale, and he is rightly called as father of forensic odontology. So Dr. Oscar Omido is the father of forensic odontology. In 1937, in Chantilly, a murderer was convicted on the evidence of the bite marks that the victim inflicted during her struggle for life. In the year 1945, the Norway established the first forensic odontology identification committees to investigate crime scenes with multiple victims. Each committee consisted of a police officer, a dentist and a doctor working together to identify the deceased. In 1946, Welty and Glasgow devised a system in which as many as 500 cards with dental data could be sorted out in 1 minute by a computer. In year 1950, Leon Snyder, a forensic expert from California, he introduced the concept that the wrinkles and cracks of the lips could be used as a method of identification. So basically he started the concept of the chiloscopy. 1978, Ted Bundy, an American serial killer who murdered numerous young women between 1974 and 78, he confessed to 30 murders, and afterwards he was proven guilty on the basis of bite marks which he inflicted on the victim before raping and strangling them to death. In 1991, Dr. Mark Skinner and Professor Gail Anderson of Simon Fraser University, Canada, reported the case of a Native American child whose cranium was discovered in British Columbia, Canada. The child's age was determined through the examination of the tooth enamel as well as stress markers in the teeth, which were correlated to incidence of stresses in the child's life. In 1972, the first criminal conviction in North America to feature evidence in the form of forensic odontology was that of Wayne Boden. Boden's trial featured evidence from orthodontist Gordon Swan, who was able to link bite marks on the victims to Boden's teeth. In 1977, Baggy mentioned that the bodies of Hitler and his mistress Eva Braun were identified by his dentist. In 1995, General Ziaul Haq, late President of Pakistan, he died in 1988 in a plane crash. His body was identified using his dentition afterwards. In 2001, thousands of people who lost their life in the World Trade Center disaster in the US were identified on the basis of DNA extracts from the toothbrushes of the victims. In 2004, forensic odontologists as a team of International Disaster Victim Identification, what we called as DVI, they identified around 5,000 bodies, to be precise, 4280 bodies of tsunami victims in Phuket, Thailand. Coming on to the India, the first case of dental identification was reported by Sansare and Dayal in their review, which he published in 1995. They said that Raja Jayachand Rathore of Kannauj, he died in the battlefield in year 1191. His body was identified using his false anterior teeth, and until recently, the identities of two sons of Saddam Hussein, they were confirmed by the dental identification as reported by the CNN News. Now coming on to the role of forensic odontologists during this whole process of crime investigation. The most common element of forensic dentistry that a general practitioner is likely to encounter is supply the antemortem records, that is the records before the death of the patient, and they help in the identification process. The forensic dentists are frequently called upon to identify the remains of the individuals who cannot be identified visually, such as in cases of burnt, grossly decomposed or mutilated remains. Therefore, the patient record is the complete story of the history of the physical examination, the diagnosis, the treatment and whatever care has been given to the patient. These records may consist of several different elements. Common ones include written notes, the radiographs, the study models, the referral letters, the consultant reports, the clinical photographs, results of any special investigations, the drug prescriptions, the laboratory prescriptions, the patient identification information as well as comprehensive medical history. Many documented cases have used this unique pattern of the palatal rogue that is recorded in an orthodontic study model to identify young individuals with no dental restorations. Therefore, the work of a forensic odontologist, that's a lot. Basically, it covers the identification of unknown human remains through dental records. Of course, there has to be presence of antemortem dental records. So afterwards the comparison can be made, and providing assistance to forensic medicine experts and police personnel in cases of mass disaster. They have got a very important role. Then the age estimations of both living and deceased, including the neonatal remains. Then they have got a very important role in analysis of the bite marks found on the victims or accused in cases of a sexual assault or a physical assault. The identification of bite marks on substances such as wood, leather and foodstuffs. The forensic odontologists also help in the identification of the weapon of offense using the same principle of bite mark analysis. The forensic odontologist can also help act as an expert witness in cases involving bite or weapon mark. Then the forensic odontologist can provide assistance to archaeologists in building up a dietary history of a tribe or a race. And coming on to the next part of this lecture, that is dental identification. Teeth are most durable of the human tissues, and the materials used in dental restorations are extremely resistant to destruction by biological, chemical and physical elements such as intense heat, as this was reported by Gustafsson in 1966. Teeth only survives most insults and consequences acquired during death and decomposition, but also resists extreme temperature and tremendous force, as happens in road traffic accidents and aircraft fire. Thus, the dental identification becomes the single most accurate means in the identification of remains when both visual and fingerprint methods are ineffective. The adult teeth pattern basically comprises of 32 teeth, each teeth having 5 surfaces. The infinite combination of missing filling material, caries, lesions, crowns and prostheses involved in this 160 surfaces, this form the basis of dental identification. The characterization is further enhanced by the specific morphological patterns of the individual restorations, the prostheses, the crowns, the removable dentures, the fixed prostheses, and the additional features incorporated in the root canals, periapical and surrounding soft tissues. Hence, the basis concept that no two dentitions are like the same. So, that is the basis of dental identification. According to the Morse Biomedical Dictionary, 8th edition in 2009, published by Elsevier, the process of establishing the unique characteristic of the teeth and dental work of an individual, thereby permitting the identification of the individual, is done by comparison with his or her dental charts and record. Identification on the basis of dental evidence is of significant importance when the person is skeletonized, decomposed, burnt or dismembered. The principal advantage of dental evidence is that, like other hard tissues, it is often preserved after death. Even the status of a person's teeth changes throughout life, and the combination of decayed, missing and filled teeth is measurable as well as comparable at any fixed point in time in his lifetime. The fundamental principle of the dental identification is based on basically this comparison of the antemortem and postmortem data. That means when the person was alive, whatever dental data is there, and when the body is recovered after the death, by taking those data and then afterwards comparing those. And this comparison may lead to the following 4 situations. First is the positive identification, when the comparable items are sufficiently distinct in the antemortem and postmortem databases. So there is no major differences are observed. So that is called as positive identification. So we can say that yes, this particular teeth belong to that particular person. Second possibility is the possible identification. That means commonalities exist among the comparable items in the antemortem and postmortem databases, but enough information is missing from either source to prevent the establishment of a positive identification. So there is, you can say, incomplete kind of thing, but yes, but still we will say that it's a possible identification. Then third is insufficient identification. Insufficient, that is insufficient or insupportive evidence is available for comparison and definitive identification, but the suspected identity of the deceased cannot be ruled out. So the identification is thus deemed inconclusive. Then fourth one is important, is exclusion. If there are unexplainable discrepancies exist among the comparable items in the antemortem and postmortem databases, we can exclude totally on the basis of that this particular teeth which is there, it does not belong to the person in question. Now coming on to the factors for dental identification. What are the factors which help in the dental identification? The first one is the number of teeth. The assessment of teeth in the mouth should include those that are present and missing. The number of possibilities that exist for the combination of teeth missing or present may well be enough to obtain a positive identification. Therefore, it is important to establish whether the teeth were lost antemortem or postmortem or around the time of death, that is called as perimortem. So this will help establish the pattern of treatment undertaken with regard to any exodontia, and closer examination of any tooth socket may give an indication as to the time lapsed since this treatment. Coming on to the next factor of identification, that is tooth loss. It is important to determine the period when the tooth were lost from the arch. In the postmortem loss, the bone surrounding the socket margins would be unresorbed and it will have a sharp profile, whereas in antemortem loss, due to the evidence of the healing process taking place within the sockets, varying degree of bone remodeling around the rim and complete fill-in of the socket with secondary bone formation is seen. The third factor is the restorations. A tooth is restored when there is a loss of tooth substance due to dental caries, fracture of tooth, or any abnormal wearing away of tooth, or for an aesthetic reason. Restorations frequently involve multiple surfaces of the teeth. A full description of the restoration must be included in the postmortem records, and this must include the material used and the surface restored. Restorations on the interior teeth involve 4 surfaces, that is mesial, the distal, the labial as well as lingual. So these are the 4 surfaces. And posterior teeth, they involve the 5 surfaces: buccal, lingual, then mesial, distal and occlusal, that means which are occluding over the upper and lower jaw. The type of filling material used range from the silver amalgam, the tooth colored material that may be a composite or the glass ionomer cement, the precious and non-precious metal used for the inlays, crowns of gold or porcelain fused to metal, and precious and non-precious metal bridgework with fused porcelain. The temporary dressings or the fillings, like the most commonly used the zinc oxide, eugenol, they may also be used. It is important to be able to recognize the areas of dislodged restorations, untreated dental caries, malpositions and rotated teeth, anomalous tooth, endodontically treated tooth, teeth with atresion and abrasion, and the dental radiographs may substantiate these findings. These are the few of the photographs which are showing the dental restorations, and this is the radiographic view of the dental restorations, which will help you to understand the process. The next factor is the dental prosthesis. Like a full denture, these removable partial dentures, the bridge, the orthodontic appliances, they are very helpful if it is known. So these are the few of the photographs, few of the figures which that shows the dental prosthesis, various kind of dental prosthesis. The next factor is the bony pattern. The medullary bone of the jaw, this possesses a characteristic trabecular pattern which can be duplicated on the postmortem radiographs. So tooth angulation, root morphology, the bone loss, specific changes in the pulp chambers and the pulpal outlines may also be assessed. Examination of the supporting alveolar bone, this may give some indication of periodontal disease during the life. The position of the maxillary sinus and its relation to the roots of the upper posterior teeth, they should be taken into account during the comparison of the dental data. Then the next factor is the oral pathology. The deviation from the normal anatomic configuration of the oral cavity, like mandibular and maxillary tori, geographic tongue, dilantin-induced gingival hyperplasia, enamel hypoplasia, and pre-existing bone pathologies like cyst are few of the examples. The presence of healed or healing fractures and the establishment of an approximate time of injury could be of help in the identification process. Then the another factor is occlusion. The occlusion and malocclusion, they have been described whether according to whether the jaw have a normal relationship when closed and the teeth may be misplaced, or whether the relationship of the maxilla and the mandible is disturbed. The amount of overjet and overbite, these are the two terms, that should also be noted, as well as the first lower molar relationship. Then the next parameter, or I can say the last parameter, is the occupation habits and social position. The trained dentist can derive a great deal of information from teeth and mouth with regard to occupation habits and social position. For example, severe generalized tooth atresion is common among workers continuously exposed to atmospheres containing abrasive dust. Certain habits may leave permanent vestiges that may help develop a profile of the individual, like chronic pipe smoking or long-term bagpipe playing may result in an obvious unilateral bimaxillary wear pattern, and notching of the upper incisor has been frequently noted in the hairdressers due to their habit of lodging the hairpin in their teeth before placing it in a client's hair. To summarize, we can say the forensic odontology is a branch of dentistry which, in the interest of justice, deals with the proper handling and examination of dental evidence. Forensic odontology is a vital and integral part of the forensic medicine that is most widely used for the identification of living as well as deceased. Although great attention was not paid to dental identification until recent times, the process has been used for more than 2000 years now. Forensic dentists are frequently called upon to identify the remains of individual who can be identified visually, such as in cases of burned, grossly decomposed or mutilated remains. The principal advantage of dental evidence is just like other hard tissues, it is often preserved after death. So even the status of a person's teeth changes throughout life, and the combination of this decayed, missing and filled teeth is measurable and comparable at any fixed point in time. So forensic odontology has played a key role in identification of persons in mass disasters, all these tsunamis where it has got a very massive role. All these, the concepts of DVI, there is a role of forensic dentistry in crime investigation like bomb blasts, in ethnic studies, as well as in the identification of decomposed and disfigured bodies.